Hi, I'm Stuart from Stuart McFarlane Optometrist. Macular degeneration is one of the most common causes of legal blindness in the world, and it's becoming more and more common as time goes on. There's several reasons for this, but the primary one is thought to be dietary. There's two main types of macular degeneration, the wet type and the dry type. In dry macular degeneration, the back of your eye goes crumbly, which affects the central part of your vision. There's no treatment at the moment for dry macular degeneration, but there are a few strategies you can do to lessen the risk of you developing it and to slow down its progression. It's important to maintain a good lifestyle, to have green leafy vegetables daily, have fish once or twice a week, and particularly do not smoke, because smoking vastly increases your risk of macular degeneration. The other type of macular degeneration is the wet form. And sometimes the wet form carries on from people who have dry macular degeneration. With wet maculopathy, or wet macular degeneration, you'll notice a sudden decrease in your vision. You may notice that lines that you know are straight, they appear to have a kink or a wobble in them. If you notice any of these symptoms, it's essential that you come in straight away. Because what's happened with wet macular degeneration is that new blood vessels have grown at the back of your eye, and the new blood vessels are leaky. So then that leads to either a hemorrhage or a leak at the back of your eye, causing the distortion and the reduction in vision. The treatment for wet macular degeneration is needles containing a substance either called Lucentis or Avastin or Eylea, and that's an anti-VEGF treatment which tends to seal up the blood vessels and shrink them. This is an ongoing treatment. It's more or less like killing weeds, where it's ongoing, you have to keep on with the injections. One of the other ways of diagnosing wet macular degeneration is through an OCT. That's where you come in, we'll put drops in your eyes to dilate your pupils, we'll take an image of the back of your eye, and they'll do an OCT, which is optical coherence topography. And what that does is it gets a cross-section through your back of your eye, more or less like an X-ray or an ultrasound, and it's done with a laser. It's completely painless, and it takes 5 to 10 minutes. And this will give us a cross-section through the back of your eye to see if there's any leaking there. So if you have a family history of macular degeneration, or if you have any symptoms of your vision becoming distorted, come in and see us so that we can exclude whether you have macular degeneration. That's Stuart McFarlane, Optometrist.